by now well aware of the Sangha Seva in the second wave of COVID-19. Free food, medical supplies, hospitals, COVID care centers, and whatnot. But the most difficult task, physically and emotionally, is cremation of the deceased COVID-19 patients. Organizations like Seva Sahayog, Swarup Vardhini, and Surajya together have accepted the responsibility of Antim Sanskar of the deceased COVID positive patients. This being one of the riskiest tasks, today with us we have Atul Nagras ji to explain in all the details and note the cause. Namaste Atul ji. Cremation of the deceased COVID patients is really a difficult task to see. Before discussing anything about it, I firstly and in fact want to know that what part of your mind made you take up this task? Is there any purpose attached to this?
Seva Sahayog, right from its inception, I mean, we have had celebrating humanity and serving humanity as part of our vision and as part of our mission that we had accepted. And since the last 15 years, promoting volunteering wherever there is a need and an opportunity to serve society, mitigate its problems is what we had thought about. So this is an unusual situation and scenario. I mean, the only time when you visit a crematorium is one of your loved ones, one of your friends, parents, or your colleagues' parents, or relatives. That is the only time when you visit a crematorium to pay your last respects. So when somebody asked us that the Pune Mahanagar Palika, the Pune Municipal Corporation, has requested some assistance in this regard to us. So before I said yes, the first thing came to my mind is that are we capable physically, emotionally, are our volunteers willing to do this? So I said, we'll let you know tomorrow. Let's have a meeting to understand what the Pune Municipal Corporation want, exactly where they need our help.
Correct.
And so I spoke to all our team, and then they all, of course, with the spirit of Seva and service, and the whole purpose, it fits into our motto. So they all agreed to listen to what the Pune Municipal Corporation has to say. And so when we met the Pune Municipal Corporation's officers, and then they explained that due to the sudden spurt in the number of deaths, the present setup was not geared to manage this. And so they asked us help in the crematorium, as well as they asked us help in setting up a facility where the death passes. It's a legal procedure. If we can even provide volunteers to manage that, and then we then took them to the crematorium to understand what their needs were, and that's so our mind was made up after that meetings, and so we decided to set it up. There wasn't a lot of thought put in because we didn't know what we were getting into, but I think this entire the need we felt was sufficient enough that we should cooperate, assist, and help them out as much as possible. This is also not the time to find faults with the administration. And they're already burdened with setting up hospitals and COVID centers, and then all the vaccination centers. And so we said, without any hesitancy or any reservations, we decided to play a supportive role to the administration. So I think that's what all the thoughts that came to my mind personally.
Correct. Sir, when we talk about cremations, there's a huge lot of process involved, I believe. So documentations, permissions, and of course the actual process of cremation. So please, if you could throw some light on the procedure aspect of this seva.
Uh, the Pune Municipal Corporation and the state government has the biggest public hospital, which is Sassoon Hospital in Pune. They have a COVID center there, which is set up to serve the needs of 1,500 COVID patients there.
Hmm.
And the procedure involves that once a patient is admitted and due to some complications due to COVID, if there is a death that takes place, the body is then shifted to what they call as a dead house. The there are doctors there which are capable of doing a post-mortem. If there is any suspicion, then the police gets involved, and then the issuance of a death certificate along with a death pass. And that's because eventually that is needed for everywhere that you go. I mean, for insurance claims, for ensuring that their
Ji,
pensions, if there's a husband who has died, the deceased gets it. There is property inheritance and all that
financial
is involved.
aspects here.
Absolutely. And so you have to ensure that all those legal procedures are abided by. You understand all those legal procedures. We had teams which were trained. We had several rounds of training that we underwent.
Hmm.
Um, we even went and interviewed those staff who are actually involved in actually issuing those certificates.
Okay.
We documented that. We made a standard operating procedure. We got that vetted from them, from the legal authorities of Pune
Ji,
Municipal Corporation and the hospital, Sassoon Hospital itself. So we've had several rounds of meetings with Sassoon Hospital Dean there, Dr. Tambe. We had several rounds of discussions in Pune Municipal Corporation authorities and the staff involved in issuing those passes. So because we
ji,
didn't want to sidestep or overstep that, and of course it's legally binding on everybody to do that.
correct, correct.
Uh, so we did that whatever was necessary, and that fully realizing that ours was a supportive role and not a independent authority which issues these death certificates.
Ji. Sir, you people are playing a supportive role. But what kind of role does state administration, and the doctors from the hospitals are they coordinating, or is it a big challenge to you?
No, no, we are absolutely coordinating with them. We are coordinating with the COVID center doctors. We are coordinating with the dead house who actually issue the certificate itself. We
Ji,
are coordinating with the Pune Municipal Corporation, which issues based on those documents the death passes. We are coordinating with the ambulances. We are coordinating with the staff at the crematoria,
ji,
and of course, we are coordinating all that with the relatives who come there asking for a death pass.
correct.
And one of the things, yeah, go ahead.
Sir, manpower here is as you mentioned, manpower here is the biggest aspect, I believe. So, what kind of network you people have built for the cremation of COVID-19 patients? Like, how many people are involved? What are their seva hours, locations, management?
Uh, there is a physical infrastructure involved and there is a manpower resource infrastructure involved. For example, at Sassoon Hospital, where the actual issuance of the death certificate is involved, uh, we had to, for example, every death pass every relative has to submit 5 different documents in to the before a death pass is issued. That is one. One of them is the death certificate issued by the doctors itself from the dead house.
Ji,
The second is the Aadhaar card, a copy of the Aadhaar card of the deceased person. The third is the relative who is claiming the body. And so 5 such different documents are there. They need all these documents in 5 copies of each of these documents. And these are
Okay.
all valid reasons. I mean, though the paperwork sounds very
Please.
cumbersome to
Yeah.
anybody, but that's the legal procedure and it's needed.
Correct.
You need a set to be given to the copy to the dead house, to the hospital itself. Then you need a set which is given to the pass issuing authority. You need a set for the ambulance because he is carrying a dead body. So he has to have a copy ensuring that he's not illegally carrying a dead body and cremating it. Otherwise, he will be accessory to murder. If and then a copy is to be kept for the crematorium itself, where they verify all those documents, and then so a set is needed there. The patients have to, so you need 25 Xerox copies. So what
Okay.
we did first thing was that we shifted 2 Xerox machines,
Oh,
one near the dead house and then one near the center where the actual thing is there.
interesting.
Uh, yeah, then we shifted to laptops there so that some nowadays everybody has it on the smartphone, and the if I have an Aadhaar card or any other document on a smartphone, we can through
Easily
Bluetooth
scan
connect
it.
it directly
Yeah.
to the laptop, scan it, print it, give 5 sets to it, and we are all doing it for free. So what procedure which used to take an hour and a half, 2 hours, now
It's taking
these
no time.
has curtailed to in 10 minutes. So we have staff there. So a staff of 3 volunteers, 4 volunteers per shift at Sassoon Hospital. So
Okay.
4 into 3 is 12 people there. Uh, 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 since they are in a public place at a hospital next to a corona center and next to the dead house, we are ensuring all the safety precautions, PPE kits and sanitization of the place itself. All that is done. So there are another set of volunteers who are in charge of the logistics, because we have to provide tea to these volunteers. We have to provide breakfast to them. Since they are working in shifts, we have to have lunch delivered to them. We needed to ask them if they have any difficulties, then conveying that. So along with these 12 volunteers who are working in shifts, there are 2 or 3 volunteers whose job is to organize all these logistics.
Okay.
Sometimes a printer gets broken down to a Xerox machine. So, because we imagine we have given almost 1100 death passes to so far in the last 2 weeks. So 1100 multiplied by 25. So you can imagine almost about 27,000 copies have been printed. So somebody has to bring the printing paper.
Look after that. Yeah.
Yeah. And uh, so printing paper, tea, water. It's hot summer months there. I mean, these are not air conditioned offices there.
Correct.
They're out in the open. It's 38, 39 degrees. Sometimes the humidity is high. So we had providing them 20 liters of cold water every 6 hours so that our volunteers are well hydrated. Because wearing those PPE kits and the masks, it's physically strenuous. Talking to people also adds to that strain. And I think so. So we have that team there, and then we have another team here in the crematorium. Uh, since the sudden surge in the number of dead patients due to COVID, the Pune Municipal Corporation had allocated 6 what you call as wooden pyres shed to us. And so we have 6 people in each shift working there, 6 into 3, another 18. We had set up a small storeroom there because we have to have a storeroom, PPE kits, gloves, head covers for them, glasses, again the same food, water, all the other
Basic facilities.
paraphernalia there. Then we realized that sudden surge, we need more shovels. So we even went and bought the shovels. The ashes have to be removed and stored. because they have to be handed over next day to the relatives. So we
Yeah.
even designed shovels of our own quickly. We had fabricators or some of our volunteers. We even got stretchers because there were a shortage of stretchers. So once the body is removed from the ambulance, the whole idea is to reduce the waiting time there. Earlier, and that's one of the reasons the municipal corporation approached us, that it was waiting time even at the crematorium for 6 to 7 hours.
Yeah.
So our volunteers would stand there once the ambulance comes in there, find out which shed is vacant. We coordinated with people there in Sassoon also. And so we are coordinating with the municipal corporation authorities there so that the body is then taken. Some people insist on, so some of our volunteers even said a few prayers for them, since not many people could come there. Initially, it was difficult for all of us because this is not something which you do on a daily basis. These are not typing Excel sheets or helping out food packets or
This is
coordinating it. This
really
is something different.
one of the
Yeah,
riskiest tasks.
yeah. And and then again, we have the other thing is that we insisted on having 7 days of working because exposure to heavy viral load, after 7 days they would be and so especially those who are working in the crematorium at Vaikunt, we ensured that they were staying isolated in Garwari College hostel. So we worked with the Maharashtra Education Society. So they had allocated a hostel where they were quarantined there away from everybody else. Again, so they work in a shift and then go and stay there at night or during the daytime. And they rested well, isolated from their families. And then after 7 days, they stayed there for 4 days, 5 days. So all the logistics there at the Garwari College hostel there, and all the logistics of food, equipment, items here. So I would say a team of 40 to 50 volunteers working in shifts is what is needed for all of this. We have been working with. We restricted this initially to people in the age of 20 to 40 because this is strenuous work. But then we got so many calls of people. I mean, I'm myself 56. So people pointed out that you yourself are 56. So what? But I think a lot of people in the age of 48, 50, they said that we want to be a part of this. We understand the risk. A lot of women came forward. I mean, that as to be volunteers. So. But we shifted them to Sassoon because that's not as physically strenuous, though the women were even willing to work in the crematorium.
Courage
So that's the logistics.
Courage is all that takes it up, sir.
Yeah, yeah. And as I said, there at Sassoon we have done almost 1,100 death certificates so far in both COVID and non-COVID, because even non-COVID would come there. It doesn't look fair that we give free Xerox copies to COVID death certificates alone. So we decided as a policy, we took a decision that we'll give it for free for anybody who comes there. Because it's a time of grief for everybody. It's a stressful situation, and to make that discrimination was not fair. So we did that.
Correct. Taking this discussion ahead, sir, I've heard that families at times even deny to be present during cremations, or in some cases, they even deny to accept the deceased COVID positive patients. So, what keeps them away, you think? How difficult it is to handle the family members at such times?
I haven't come across a situation because this is, I mean, we are a close-knit community and a loving community where family comes first in our culture.
Correct.
That has not been my observation both at Sassoon or at the crematorium. They never abandon even the dead. I mean, people want to walk and pay their last respects and do the difficult part for them is that they cannot do the last rites as per the tradition, and
as per the Hindu
because that
tradition.
is the last samskara And so even some of us convince them that this is an unusual situation. We'll say the mantras for you at your request. So some of our volunteers who were young, who had never even thought that they would say the Om Purna Mada Purna Midam last rites and pay their respects there for those on behalf of those families. So families do come. There was a restriction there earlier, but we had to keep them away, request them, saying that that this is not a safe place, at least in clinical terms or in medical terms. So families never leave. I mean, if you go to a dead house, the entire family is there at times. There are fathers and brothers and sisters and friends and relatives, uh, and of all classes of society. I mean, and all different religions.
irrespective
So,
of caste and creed.
absolutely, absolutely. So,
Sir, the Seva work you people are doing is quite risky. Are there any financial medical facilities you provide to the workers who are helping in the cremation tasks?
uh, for us, they are not workers. So they are part of our family.
Yeah,
In Seva Sahayog, we say that we are a family working together, serving society.
correct.
Uh, so one thing, the first step we took is that what all precautions that we can take to ensure that the volunteer who is decided to participate in this is safe. So all isolation procedures while they are working, isolation and quarantining procedures after their 6 day or 7 day of work stint is over. So we've taken care of that first. Secondly is all the medical requirements in terms of PPE kits, gloves, sanitization, head caps, all that we provide for them. So that is the second. The third part is in Seva Seva. We have been frontline workers. We have vaccinated all of them. So there, some of them have completed their first dose, and some of them have completed. Very few of them, of course, because their days are not complete yet. The vaccination has been done. The third thing is that the doctor inspects every one of them every day, ensuring that they have no conditions either. So there is oximeters and ensuring that they are on a daily basis kept safe. And the last part is that I mean, though it is an last contingency, is that we've even done medical insurance of all those who are working there. Uh, uh, because accidents can happen, and we are committed to ensure that we take the responsibility of all those volunteers. We've taken their list, their Aadhaar cards, and then we got them all insured. And that's an important step. We even kept some fund aside in case of an emergency. Hospitals have come forward and said that don't worry about if in an eventuality that we will do we're taking care of them for free. So even that was an assurance. That's our commitment to parents. I mean, I've had parents call me and saying that why are you risking yourself and some of them there. Uh, so we told them about all of this, and then they agreed to do this. Some even called me and warned me about the dangers there, and I said, yes, I know that, but I mean, you've had soldiers fighting at the border, and we never question when they die. And we've had medical staff working in ICUs for 12 months, 13 months in a row, working with COVID patients all the time, or all the COVID care centers, nurses, doctors, medical attendants, and support staff. And we have no right to
Question them.
we never question that service, but then when it comes to our own responsibilities, if we question that, I think that's not fair, and that would be shirking our responsibility in the hour of society's need.
Correct.
So we have taken as much precaution as possible, as much care as possible, and also psychological counseling, talking to them every day, and so
I'm
ensuring
coming.
that.
Yeah, And coming back to that point as well, cremation thing that is difficult psychologically. It's very difficult to handle these things. So, do you think that this process somewhere affects the minds of Seva workers? And how do you people deal with this emotionally?
Uh, those who are working in Seva, this is they are not novices.
Hmm.
And unless and until you have that kind of empathy in your heart, you usually don't step forward.
Ji,
Uh, so my hats off to all of them. They are mentally prepared in the first place.
ji,
The difficult part is when you lit the fire of a human body and the smell of burning flesh, and in the
hmm,
38, 48 degrees heat in summer, when you have six fires lit all at the same time, and then two, three ambulances waiting in line, handling that, the whole questioning the whole purpose of life itself. I mean, I think uh,
that in
that is
itself, yeah, that in itself is the
that
difficult
itself is
task.
the listening and talking to the relatives, and especially when you have somebody who is very young died, a husband or wife or a son, and then parents there. I mean, dealing with that also is even more tough.
Right.
Uh, so uh, uh, I think the psychological sessions, talking to them, I mean, there is no great logic to it or purpose to it, but uh, uh, bringing the attention to the larger need of society and society's problems itself, telling them that itself is motivation for all of them.
See,
And the first few days are tough, but once those few days are gone, when relatives thank them, uh, uh, and write emails and WhatsApp messages to us about the great work that all these volunteers are doing, that helps them that we were part of a process where we healed the pain, though it can never be replaced.
ridiculous.
But we were a small contribution in healing that pain of the last ride, walking up before they go on to the next journey. I think that's where the volunteers, after 2 3 days, uh, uh, are, are doing it.
Ji, ji. Sir, I'm sure there are many stories and incidents to this kind of selfless seva you people are doing. So, what is one that incident that you will never ever forget?
Uh, I mean, there are so many of them.
Also, sorry to
I
interrupt, sir.
mean,
Also, if you could tell us something about the Seva Sahayog Society and its service.
yeah. I mean, there are many instances. I mean, one of our, I mean, as I told you, this is not Seva Sahayog alone, which is working there.
Correct.
We have a lot of Swayam Sevaks from Swarup Vardhini
Ji,
and Surajya Sarvangin in Pune, who
ji,
are, we jointly are working there as one team,
ji,
as one group there. So it would be my disservice if I do not mention the other two institutions. So they are there.
ji, ji,
Uh, One of the most touching was Nilesh Dayarkar, a young volunteer from Swarup Vardhini. He celebrated his birthday there. And uh, I mean, somebody who is 28, 30 years old uh, always would want his birthdays to be spent uh, with friends and family and cutting a cake and having a party and then getting all those congratulatory wishes. But Nilesh chose to be there. And so we had a small little function for him, and we didn't have a gift, so we took a packet of gloves and gifted it to him. And in that spirit, he decided that we even told him that you can go take off from today, and but he said no, I want to be here. And so that was very touching. And then it gave us a lot of hope that the young generation do care. Society does care. It is not as if they have abandoned and become selfish. People want
Mhm.
to help each other.
Correct.
We've had women in all that stress and that heat working there. The toilet facilities in in a public institution is not of a great quality or of but they still continue working there. I mean, you take breaks and lunch breaks there, and still they enjoy the food and the person who cooks the food. Uh, I think that was touching. I think relatives who come there with agony and anguish about the administrative problems and the delays. But
Mhm.
once they talk to our volunteers, and have few instances where once they talk, our volunteers gave them a patient hearing and help them coordinate all that. And the tears in their eyes, I think. There are a lot of blogs that some of them have written. We'll probably share it with you.
Sure, sir, sure.
It's very touching. All those volunteers. Uh, Seva Sahayog started as a volunteering movement. I mean, I think we started in Pune and now we've spread in Mumbai and Navi Mumbai and Thane, and then we have few volunteers in Solapur and want to start in Nashik. The whole idea is that uh, society's problems. I mean, the government is not the ultimate solution. Civil society, citizenry have to participate and contribute, working along with the administration, especially in
Yes.
these time of need. And so Seva Sahayog started as a volunteering movement. We have today in Pune, Mumbai, Navi Mumbai, almost about 30 to 40,000 volunteers who are part of our database. And there are many activities that we do. The famous school kit activity, we almost give more than 100,000 school kids as education aid to children from the underprivileged, promoting education. There are 70 education centers that we run on a daily basis in Pune alone. 100 of them are in Mumbai. Pune, there are about 6,000 students who study there from 1st to 10th. And there are education aid programs, scholarship programs, women empowerment programs that we run, and the famous Nirmal Wari, where we installed moving 3,000 toilets all along the way, and taking, and so almost make it defecation free.
Correct.
The Wari,
Correct.
which is a 700-year-old Maharashtra tradition. Uh, uh, and I think when educated people, young people participate in social transformation, I think the whole uh, uh, the pace and the urgency with which change happens is very gratifying. Government alone is not capable of solving society's problem.
Correct.
Society has to step in and walk up and help the administration to do that. I'm sure we can find 100 faults there, but Seva Sahayog has decided that we will be part of the solution than part of the problem.
Problems.
And I think, yeah.
Yeah.
And
As it
society has
is,
helped us. I mean, we have never short of volunteers ever. Yeah, go ahead.
as it is rightly said that if we want development, we will have to be the development, the change. Yeah. So Atulji, you have seen the COVID crisis very close, I must say. I would request you to please give a message to the society who is struggling to survive in this second wave of COVID-19.
Uh, I think the first thing to do is to that have faith in uh, uh, uh,
The administration.
that this time will pass. Um uh, this is a dark night, and but there will be a sunrise tomorrow. Uh, so this would probably last a few months, maybe linger on a little bit more. But don't believe in horrid newspaper stories. There are people out there in the front line, uh, people, educated people, professors, doctors, students, who are coming forward and mitigate the problem. So ensure that understand the problems also.
जी,
Don't suddenly blame the administration, because this is a nightmare which nobody can plan for.
जी,
It's like a flood suddenly comes. Of course, there could in hindsight everything can be done, but for a 1.3 billion population, for a poor country like India, to ensure and create a risk-free society is not yet possible. I mean, even a rich country like the United States, a year ago in June and July, we had bodies outside hospitals lying in New York, because I have friends there and who work in the healthcare sector there. So every society has different problems. Every society has their own resource limits. Every society have structural governance limitations. But this will pass. Wherever possible, try and put forward and say, what can I do? I mean, you can either complain about the problem or you can say, what can I help? I mean, you can help
जी,
out in finding out people who have had COVID patients who have recovered, and then donate for plasma. You can, there is a shortage of blood now because colleges are closed. So can you organize blood camps in the society that you live in? Can you call up people and ask and find out if people have been vaccinated? A large number of people are fearful about the vaccine,
correct,
so dispel their myths. Uh, so there are helpline being set up by various people. So volunteer there, and I think that's the best you can do. I am very hopeful that in spite of all of these problems, there would be losses, but we as a society, we will recover, we will rejuvenate, and we'll bounce back. But hope has to be kept alive. I am very hopeful. I see nothing but positivity in all those volunteers and the medical staff and the nurses out there working. And so keep the negativity away purposely now at this
correct,
time of crisis. And then we have time to criticize for the rest of our lives again anyway.
जी,
So I am very hopeful. I want to thank you on behalf of Seva Sahayog and the other two organizations, Swarup Vardhini and Suraj, for giving me an opportunity on behalf of the volunteers, because I am only the face today,
जी,
uh, but there are 100 volunteers at the back who are quietly working. They are the true, I don't
जी,
know, the people who are the frontline warriors. Even in the crematoriums, they're working. So thank you very much.
yeah, we have a huge respect for all the Seva workers, sir. Thank you for joining in, and I hope this COVID crisis diminishes as early as possible. And as you said, the ray of hope. We must be positive in this negative times. Um, so thank you for joining in, sir. Thank you so
Yeah,
much.
I want to share one more thing. Since we are in the hospitals and we are in the crematorium, last 1 week I've seen a 30 to 40% drop in the number of both the load on the hospitals and the load at the crematoriums and the
Okay,
death passes also.
जी,
So because
that's amazing.
we get the statistics first,
जी,
and so we're already seeing that the wave ebbing away. We have to be cautious. So please do wear a mask, keep
जी,
social distance, cooperate with the authorities, cooperate with the medical staff. They're working under strenuous conditions. Do not believe in quacks. Believe in your medical system there. And I think I'm already seeing some hope where the wave is ebbing. So hopefully by the end of May, we'll see the tide turning, and
right.
now we will be eventually be much better prepared if and when the third wave probably would come.
If at all the third wave comes. Sure.
If at all, yes.
Yeah.
And I hope and pray to God that the third wave never comes, but it would all depend upon our collective wisdom and cooperation and following all the norms. So I wish you also very well and your family. Stay safe, stay healthy.
Thank you, sir. Thank you for joining me.
Thank you very much.